What is the best method of contraception for breastfeeding mothers? We've had people say that when a woman is breastfeeding, they cannot get pregnant. We have mothers saying that they got pregnant while they were breastfeeding. I want us to discuss this and understand how true is this analogy and what these mothers could have done wrong. Let us discuss contraception in breastfeeding mothers. Hello, guys. Welcome to the fertility series by Dr. Raisha. And here we talk about women's health, fertility, and everything in between. Today, we are talking about contraception in breastfeeding mothers. And we have said that people say that when a woman is breastfeeding, she cannot get pregnant. But we have seen some women get pregnant while still breastfeeding. And now we want to know, is that a myth or are they doing something wrong? Let's talk about the first method, which is lactation amenorrhea method, or the LAM, or the LAM, whatever you want to call it. Now, this method states that a woman has to meet three things to ensure that she does not get pregnant. The first thing is that the baby has to be breastfeeding exclusively, fully. The baby should not be taking any drinks or solids. Because when the baby is taking foods or any additional supplementation, this means that the baby will be breastfeeding less. And this means that there will be reduced production of breast milk. And this means that there could be regain of fertility. So this woman should be breastfeeding exclusively, frequently, at the intervals of every 4 hours during the day and every 6 hours at night. Another thing is that this woman should not have started her periods. And when I talk about periods, I do not talk about postpartum bleeding. When women give birth, they have postpartum bleeding. And postpartum bleeding is okay. What I am talking about is her monthly periods. And another thing, the baby should be less than 6 months old. Now, when a woman meets this criteria and is following these three things to the letter, she will not conceive while breastfeeding. Another method is the barrier methods. I am talking about the diaphragms, the male condoms, the female condoms. The main problem that these women face is vaginal dryness during sexual intercourse. This is because they have very low levels of estrogen and progesterone. And low levels of estrogen actually lead to vaginal dryness, and hence they can use lubricated condoms to ease this dryness during sexual intercourse. Another method is the IUD, that is the intrauterine device. Did you know that the IUD can be inserted in a woman's uterus immediately after birth? Yes, women can get this immediately after birth. And if they do not get it after birth, they can get it anywhere from 4 weeks to 6 months after delivery of the baby. Another method is the progestin-only pills. Now, these pills, women are supposed to take one pill every day at the same time every day. If you take it today at 2 p.m., you will take it tomorrow at 2 p.m. and the other day at 2 p.m. Actually, they can take it from 3 weeks after delivery of the baby. But it is not the best method because in some women it could reduce production of breast milk. But it is recommended that you take them from 6 weeks after delivery because at this time the breast milk production has been established and they will not reduce breast milk production. Another one is the implant. Now, for the implant, it is a small rod that is inserted on the inner upper arm, somewhere like this. And the implant, it is recommended that you insert it or you get it inserted 6 weeks after delivery because the breast milk production has been established and it will not reduce production of breast milk. Now, the other method is the Depo. That is the Depo-Provera. Now, the Depo-Provera is the 3-month injection that women get. Now, it is recommended that women get it 6 weeks after delivery. Why? Because the milk production has been established and it will not reduce production of breast milk. But it is not the best method because it can reduce the bone density of the baby. Remember that these methods are hormonal and some little hormones are expressed in breast milk. They get to the breast milk. Another method is the emergency contraception method. I am talking about the morning after pills, the Plan B pills. Women who are breastfeeding can take emergency contraception. Yes, small amounts of these pills of these drugs actually can get into the milk, but they are very small and they are not expected to harm the baby. When a woman takes the emergency contraceptive pill, she should wait for at least 4 hours before breastfeeding the baby. But frequent use of the emergency contraception pill is not recommended in a woman who is breastfeeding because this could harm the baby. It could also impact future fertility. Now, we have other methods such as the combined oral contraceptive pills. Now, these are pills such as the Femiplan, the Microgynon, the Yasmin. Now, these pills contain estrogen, and women who are breastfeeding should not take this method. I want you to underline not. This is because they have estrogen. Estrogen reduces the production of breast milk, and when they are taking them, that means that there will be less breast milk, and hence the baby will not be getting enough milk. Yes, and they can take them anywhere after 6 months. Remember, when a baby gets to 6 months, now they can take solids, they can take fluids, they can take additional supplements. And so, if the baby can take these additional supplements, that means that they do not need a lot of breast milk. And so, this woman can take the combined oral contraceptive pills after 6 months of delivery. And those are the contraception methods that mothers who are breastfeeding should use. I really hope that you have understood the different contraception methods and how these women should use them. If you like this video, please do not forget to give it a thumbs up. And if you have not subscribed, my dear, please subscribe and hit the notification bell down below.